While we celebrate nurses this week, but we have to also acknowledge that too many nurses are overworked because of staffing levels that are simply inadequate. And we had this big fight in California. For decades, you've been telling me that there are not enough nurses, especially in hospitals. And study after study shows there's simply a national nursing shortage. By 2020, it is estimated that the demand for full-time nurses will exceed supply by 1 million nurses. And this is unacceptable. We must address a problem that affects quality care, and we have to address a problem that is driving too many nurses away from the hospital bedside. There's just so much, a person can do. And I know just caring for family members when they're really sick, the toll it takes on you. And we don't want nurses to become deadened to the whole humanity thing. And if you're so overworked, it's not going to be good for you or the patients, that's for sure. So I am pleased to announce that I have introduced today the National Nursing Reform and Patient Advocacy Act. We're very excited. Yes. It's exciting. This bill will not only help address the nationwide shortage of skilled nurses, it will improve the quality of health care for all Americans. The legislation champions nursing rights, nursing ratios, and nursing reform. And I would argue this legislation represents patients' rights as well. Yes, because this bill protects the rights of nurses to speak out for patients and to speak out for themselves without fear of discrimination or retaliation. If there is a problem in your hospital, you should not only be able to talk about it, but you should be able to do something about it. That's part of your job, and you shouldn't be punished for doing the right thing. So, second, this bill sets minimum nurse-to-patient ratios because patients will simply not get that high quality of care if nurses do not have the time to provide it. It's a no-brainer. It's very, very simple. We understand if you're running around and have all these problems, you're just simply not going to be able to give the care that you want to each patient, and the patient can suffer mightily because of that. And finally, what this bill does, it creates a registered nurse workforce initiative that invests in the education of nurses. And because we know that medicine, just like more than almost anything else, is changing every day, right? And what was good practice 10 years ago is not good practice today. And now with all the technology, you have to keep up, you have to almost be an engineer today to do your job. And therefore, you need the training. Now, a poll of nurses nationwide found that this is really something, half of nurses plan to quit their jobs, I'll say this again, found that almost half of the nurses who plan to quit their jobs say that inadequate staffing is the reason they are leaving. It's no different than any other field. It's no different. And you can't be effective if you're so overworked you don't even know what day it is when you wake up in the morning. Now, here's the thing. The cost of replacing these valuable professionals when they quit, the cost of replacing them has been estimated at $25,000 to as much as $60,000 per nurse. So in other words, when an experienced nurse leaves, you have to now teach somebody else everything. How does that hospital work? How does the record keeping work? You know as well as I do the training that it takes. So we need to retain nurses, not lose them. And that's why we need this bill. It's so important. We need your help as we embark on this healthcare reform effort. At 2.9 million strong, nurses are the largest healthcare workforce in our country. I'm going to say it again. You are the largest healthcare workforce in our country. Your voices are authoritarian voices when it comes to this. You speak with authority. You know what is going on. And with your help, I know we can make progress and bring about a positive change for nurses and patients. I want to close with this, and it's touching and moving to me, because we've all had family members that could never have made it without caring nurses, and in their last days could never have gone peacefully without caring nurses. So what I'm going to say now is very touching to me. For every wound you have helped to heal, and for every patient you have ever watched over, for every life you have saved, and every family that you have comforted, you have my thanks and my support. And this bill that I introduced today is for you and for the patients you so faithfully serve. Thank you so much. I'm with you all the way. Thank you very much.